Hello, and welcome to the Stem Cell Healing Institute podcast. In case you have any questions regarding this program, please write us at info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome back to the Stem Cell Healing Institute podcast. We are here once again with Dr. Zahra Figueredo. She is the Research and General Director of the Institute. How are you, Doctor?
I'm well, Luis. Thank you so much. How are you?
I'm doing great. So today we're going to talk about the rotating cuff injuries. So if you have issues with your shoulders, stem cells can be the option to feel better. Doctor, what can you tell us about the stem cells on the rotating cuff?
So yes, Luis, the rotator cuff is a very, very common, in fact, for a lot of gym goers and gym rats, but also, golfers and tennis players. And a lot of the activities that we do require the use of our rotator cuff. And lately, we've been getting a lot of inquiries and a lot of rotator cuff injuries. And so we thought that it might be a good idea to talk about it a little bit further. The rotator cuff is basically the whole capsule where there's the biceps tendon, the subscapular tendon, the intra-articular joint space where between the two joints and the cartilage. And so it's this big area that encompasses tendons and joint space and cartilage. And so it's really important that when we are dealing with the rotator cuff, we know where exactly the injury is. We don't want to do any blind injection. So, of course, we would look at a good MRI and know exactly where the injections are. And then we do this under fluoroscopy in order to really visualize the damage and to inject exactly where the stem cells are required to do the best possible job. And that can be within the tendon itself, as well as in the joint space, the cartilage area, and even the soft tissue, the muscle, that we might see torn muscle. Because of tendon damage. So we may even inject in the soft tissue of the muscle as well, which is really important. So those local injections are super important because blood supply to tendons and joint spaces is very limited. So putting stem cells IV will not do the job that we require in this case. So when we're dealing with joints and tendons and ligaments, we have to do injections right into those damaged areas.
So we can say this can avoid surgery, right, Doctor?
Oh, absolutely. Absolutely. We can completely avoid the pain of surgery, the downtime of surgery. With rotator cuff injuries and stem cells, we can have patients, patients are normal activity after 3 days. They're taking it easy with the gym and so on and so forth up to a few weeks, but normal activity after 3 days, a little bit of immobilization for 3 days, and after that they continue on normal activity. Oh, and Louise, I think it's really important for me to mention that even post-surgery, we've had rotator cuff patients that have had surgery and were still in so much pain and debilitation, and they couldn't continue doing a lot of the things that they wanted to do or were expecting to do after surgery. And we have reinforced the area with stem cells with great success. So we have had success avoiding surgery altogether, as well as success even post-surgery where the surgery just didn't do a good enough job for our patients, and they were continuing taking pain medications and couldn't lift, couldn't bench press the way that they wanted to or that they did prior to surgery or injury, and we got them to where they wanted to be. So it's really important that we understand that it can replace surgery or even, you know, take place post surgery.
Can I ask you, doctor, if we can dive a little bit deeper into how the stem cells work for this type of injuries? What is the mechanism of these stem cells? How do they work?
Louise, that's a very interesting question because it's we hear our patients and we all hear about stem cells more and more lately. It is really the future of medicine. We've been doing it for decades, um, and people still fail to understand what stem cells actually do and how are they actually working. And so your question is so relevant, and I'm so happy to answer that. I'm glad you asked me. So what happens with stem cells is the stem cells in and of themselves are self-renewing cells. They can basically grow and grow tissue. Okay, so when they are placed in an environment with a damaged tissue, for instance, where that damaged tissue and that damaged cell, it breaks open or lyses and releases cytokines. These are chemical messengers that are specific for that broken cell, okay, or that damaged cell and that damaged tissue in the grand scheme of things. So that cytokine is released, telling the stem cell that, hey, stem cell, we need you over here to reconstruct the damage. Okay, and so what that stem cell does is it self-renews with that tissue, with that cell. And so we get a building and a regeneration of damaged cartilage. We get a building or a regeneration or reconstruction of bone if there is damaged bone there. The exact same idea with tendons, torn tendons, and ligaments, and any tissue really. And so that is the mechanism of how a stem cell regenerates, basically reconstructs damaged tissue.
So, doctor, in this case, do you only use stem cells in that injection or do you use something else?
That's a super question, Louise, because we have a proprietary cocktail that we have devised and formulated. So we use a combination of stem cells as well as growth factors from the patient's own blood. And we may even fortify that with exosomes, which are growth factors from stem cells themselves, and a few other ingredients that it makes up our proprietary cocktail. And so we inject that into various areas of the injury. So it's not just one injection, it'll be several injections just to make sure that we are getting in this specific area and we visualize it, but we also flood the area wherever it needs, wherever we feel the stem cells need to be. And so, so it's really important that we have enough stem cells alive and kicking.
When you say enough stem cells, doctor, like how many are we talking about? Into millions?
Mm-hmm. Yeah, we're talking about hundreds of millions. So if we have it depends on the degree of damage also. But if we have a rotator cuff that has torn tendons and cartilage is damaged, and maybe there's bone damage as well, and whatever the case may be, it can be into the hundreds of millions of stem cells, and with that, in that cocktail, so that we can have the best possible results, because we don't want patients coming back. We don't want to alleviate symptoms for maybe a few months or maybe even a year or two, and then the patients have to come back. A lot of clinics do operate that way. It's about a revolving door. For us, it's about fixing and completely regenerating the damage so that you don't have to come back. Unless you had some major injury again, or re-injured, or just are not, no proper lifestyle changes, and or just the normal wear and tear. So we use an abundance of stem cells.
So that is great, because it's like only one treatment and you will live a better life after that. So, doctor, that's a lot of information. That's great information you have given us. I was wondering if you have anything else that you want to add to this podcast.
Yeah, I think just to finish up really quickly, when we have damaged, when we have injuries, those physical, organic musculoskeletal injuries, it's really important that we address inflammation, the correct type of nutrition and key supplements, oxygenation in order to promote healing with the stem cells, even in many cases, growth hormone therapy. So these are all things I'm mentioning because we address all of this in our comprehensive stem cell treatment package in order to have and create the best possible environment in the body for the best possible healing. So I just wanted to mention that really quickly.
Excellent. So, in case you have any questions for Dr. Figueredo, please send us an email to info@stemcellhealinginstitute.com. And also, if you want to watch this podcast on a video format, you may do it by checking our YouTube channel, which is Stem Cell Healing Institute. You will find tons of videos with a lot of information and maybe a treatment that will suit you. So please visit our YouTube channel as well. Doctor, I wish you a great weekend. Have a great one.
Thank you. Same to you, Luis. Have a great one.
Okay. You take care. Bye-bye.
Okay. Thank you.
If you want to contact us at the Stem Cell Healing Institute or Dr. Zahra Figueredo, you may do it by calling us. In North America, you may dial +1-209-690-7836. Also, if you want to write us by WhatsApp, you may add +502-4220-7297. Please send us an email at info@stemcellhealinginstitute.com. And don't forget to visit our website, stemcellhealinginstitute.com. Also, if you like to recommend our treatments, you may find us on Facebook at Stem Cell Healing Institute. Please follow us on Instagram at StemCellHI. If you want to recommend this podcast, please refer to anchor.fm/stemcellhealing. Also, you may find us with that very same name on Spotify. If you want to watch our videos, please go to Dr. Zahra Figueredo, that is on YouTube. Thank you.